HIV is probably the biggest global health threat that we face today. But what are scientists doing about it? With me today is Professor Andrew Lever, a specialist in HIV and infectious disease. Briefly, what is HIV and what is AIDS, and what's the difference between the two?
Okay, so HIV is an abbreviation for the human immunodeficiency virus. And the human immunodeficiency virus is an infectious agent like flu. It's a virus which infects people, and over the course of quite a long period of time, usually a matter of years, it attacks the immune system of the individual that infects, so that the person becomes less and less able to fight other infections, and they become immunodeficient and they get the acquired immune deficiency syndrome, and that's AIDS, AIDS.
Thank you very much. And how is AIDS transmitted, and so who is at risk?
HIV is transmitted predominantly by sexual contact, both heterosexual and homosexual contact. There's a small risk of transmission from needle stick injuries, usually in the healthcare professions, where people have accidentally inoculated themselves with a needle which has been in somebody who's HIV positive, but that's relatively uncommon. It's transmitted from mother to child, usually at or around the time of birth if the mother is infected. And it can be transmitted by intravenous drug users sharing needles. There's also a risk, if you're a baby born to an infected mother, of picking up the virus from the breast milk of your mother.
Thank you very much. And where did HIV come from?
All of the evidence has really become very persuasive and compelling that HIV is a virus which is so closely related to viruses we find in monkeys in West Africa that the virus must have crossed from different monkey species into humans. There are two major types of HIV, HIV-1 and HIV-2. HIV-1 is very, very similar indeed to a virus which is found in some chimpanzees in West Africa.
Okay.
And HIV-2 is very, very similar to a virus found in another species of monkey, the sooty mangabe.
And that's looking at molecular sequences.
That's correct, yeah.
And comparing them to see.
Yeah. And these almost certainly have been transmitted by blood contact.
Mm-hmm.
In the monkeys, the viruses are transmitted between the monkeys by biting and scratching during fighting.
Gosh, okay.
In West Africa, there is quite a vigorous bushmeat trade where monkeys are foodstuff, and so the blood from the slaughtered monkey can very easily get into the cuts on the hand of the individual handling it. And all the evidence points to that being a cross-species transmission. It's very similar to the same way we've acquired influenza from birds and pigs and such like. It's just another cross-species transmission.
How do scientists go about studying HIV, and what kind of approaches work best to learn more about it and how perhaps they might treat it?
Well, I think your last comment is exactly right. What we really want to do is to be able to understand it so that we can find new ways of treating it. Mm-hmm. It's an absolutely devastating epidemic. It's being called the greatest public health problem on the planet, and that's almost certainly the case. Certainly it's the greatest public health problem in Africa. We want to understand how the virus works, so we study it in the laboratory by pulling it apart and studying its various components. We want to study how it works, how it replicates in humans, so we study humans who are infected to see how their immune system responds to it. The idea being, hopefully at some stage, to work out how we might develop a vaccine to make people immune. And
am I right in thinking there are people with natural resistance as well to HIV?
Yeah.
Are they useful to look at?
There are several groups of people who have some degree of resistance to HIV. There are a very small proportion of people in the Western world, Caucasians, who lack a protein on the surface of their cells by which HIV can get into the cells.
Okay.
And so these people are naturally resistant to the virus which is transmitted by sexual contact. If by chance they get a virus inoculated into their blood, then through drug use and needle sharing, then they can still get infected. But
that would be unlucky, wouldn't it?
That would be unlucky, yeah. There's clearly differences in the way in which different people respond. There are some people who get infected and remain well for many years, 10, 20, 30 years perhaps. And these individuals, the so-called long-term non-progressors, must be able to teach us something about what are the best bits of the immune system to try and work on to protect the rest of society against it. But these are relatively uncommon individuals. The vast majority of people are fully susceptible to HIV and will get disease after infection in a period of some 5 to 10 years.
And so what kind of treatments are available at the moment for people in the West?
In the West, drug treatment is really one of the greatest medical advances there's been in the last 20 years. From a time 20 years ago when HIV was almost a death sentence, we now have 20 or 30 different drugs which we use in combinations of 3 or 4 at a time. And we have to use combinations because the virus can change very quickly and can mutate to escape them. But in combination, they can suppress the virus down to undetectable levels. And that reverses the damage that's been done to the person's immunity, and they can be restored to effectively a normal life. But it does depend on them taking the tablets consistently, not missing out doses, and being on treatment for life. As yet, there has been no success in eradicating HIV from someone once they've been infected.
HIV used to be called the gay plague, and this was associated with social stigma. Do you think this kind of discrimination goes on today?
I think there is still a huge stigma in many parts of society against people who are HIV positive, and much of that is born of fear. I think if you look back over the centuries, if you take a large historical perspective, historians would tell you that every new infection that has come into the human race has struck fear into people's hearts. The plague, bubonic plague, smallpox, everything. We're deeply scared of infections. And so we tend to try and keep people who are infectious away from us or to avoid them. And it's exactly the same with HIV. Added on to that, of course, were the stigma that HIV was associated with what many people felt was abnormal sexual activity, very highly promiscuous homosexual activity. And that was felt to be some sort of judgmental aspect of the infection. I think in most places in the West this is less of an issue, although it certainly hasn't gone away. I think in many parts of the developing world it is still a huge issue. And stigma is one of the major obstacles to getting people to come forward to be tested in the first place, because they don't want to be found out. They don't want to know they're HIV positive. They don't want other people to know they're HIV positive. And that is preventing people from getting treated at an early stage, and so people are dying as a result. So it is an enormous problem, the social side.
Are there any ways that we can use viruses for our own benefit, take them back and make them useful?
We can. It's not something that should be seen as a very big issue compared to the enormity of HIV. I mean, HIV and AIDS it's killed 20 million people. There are 40 million people infected at the moment. So all of our focus of effort should be going on trying to get rid of that. However, there is the fact that these viruses are very adept at getting into cells and delivering genes. They can get into cells which are very difficult to get genes into, like cells of the brain, cells of the liver, cells of muscle, which are tissues where we commonly want to replace or repair defective genes. And so we can actually hijack them and turn them into Trojan horses and deliver genes that we think would be useful into tissues. And there's quite a lot of work going on using both HIV and its relatives, but also other families of viruses. HIV, it happens, because it's such a huge problem, is probably the most studied virus on the planet. It's probably the most studied piece of DNA on the planet. So we know so much more about that virus that we're able to use it more easily than we are some of the other viruses.
Thank you very much.
You're welcome.